Hey folks, it's Dr. Sam, and I'd like to welcome you to an EyeClarity podcast. This is a special show today. We are at Podcast 100, and to celebrate, I thought I would bring you down to one of my favorite places in Santa Fe, the Santa Fe Rail Yard Park. And over here on the right is a fabulous place for artists. It's called Site Santa Fe, and this is just a confluence of poets, writers, painters, musicians, and putting together different kinds of programs. It's one of my favorite places. Right now it's kind of slow due to COVID-19, but in other times it has been a mecca for the artists. Now, as I cross the street and we go to the left, we have a place called the Santa Fe Rail Yard Performance Center. I actually do a lot of African drumming there. We have a lot of dance classes, and it's a real center for artists in Santa Fe. And then if we go to our right, we pan to the right, we're here at the Santa Fe Farmers Market, and so on Tuesdays and Saturdays, this place is packed. In Santa Fe, well actually throughout New Mexico, it's an amazing organic agricultural farmers and artisans that show their wares on Tuesdays and Saturdays. And it's really fun. Sometimes some musicians show up, so it's even with COVID, we're still pretty packed. So as we move to the Santa Fe Rail Yard, this is kind of the center. It's a great landmark picture. What I thought I would do is take 3 questions today from the audience, and this is the first question. This is a great question because this is a lady who is very interested in green tea, and in my eye vitamin we actually have green tea extract, which I've put in my eye vitamin, and she wants to know why I've done that. Well, green tea extract actually has been shown to improve dry eye conditions. It supports the corneal surface by inhibiting a protein which is called the MMP-9, and it has been proven to be an occasional support for dry eye syndrome. So that's one reason why I put the green tea extract in there. Also, the green tea extract has been shown to protect the eyes against the harmful blue light. I talk a lot about blue light, and we talk about zeaxanthin and astaxanthin, but green tea extract is another type of, we call it a catechin, that can actually act as a scavenger for free radicals. It also protects against ultraviolet light, prevents cataracts, and it also helps in the protection of age-related macular degeneration and glaucoma. So this is why I have put green tea extract in our Whole Health Eye Vitamin, because I think it really supports eye health. So as we continue walking down the Rail Yard Park, we're going to come to another landmark, and the landmark is the Jean Cocteau Theater. This is one of my favorite theaters in town. It's an old-time movie theater, and we get to see the classics here. So we're going to come to it on the left momentarily. Anyways, I've seen some really great movies here, and right now they're taking a hiatus, but it is definitely one of the landmarks in Santa Fe. And if you ever come here, I would definitely check out the theater. They always have some wonderful movies that they're playing, and there's also a great coffee house, so you get some cool food while you're watching. All right, let's take question 2. This is from a gentleman who's suffering from a condition called nystagmus. And this is a condition that is very serious, and there aren't many allopathic treatment modalities that are effective. So, what is nystagmus? Nystagmus is a condition where there is an oscillation in the eye movements, and they can either oscillate back and forth horizontally, vertically, or even in a circle, like in a rotation. Now, in the nystagmus condition, there are two types of nystagmus. One is called congenital, and the other is called acquired. Usually, the congenital condition will start showing up anywhere between 6 weeks and 3 months in life. And again, it can be genetically influenced, so there are some genes that can cause nystagmus. Sometimes there's a secondary cataract that can form. Albinism is another reason why. This is the skin pigmentation or lack of skin pigmentation, and that's the child's part of it. Now, in the acquired, which is this gentleman who's asking the question, this occurs later in life, and again, there are a variety of reasons why we might have this oscillation in our eyes. It can be due to alcohol and drug use. Certain pharmaceutical drugs can trigger it. If you've had a stroke, any neurodegenerative disease makes you vulnerable to the nystagmus. And then there are the conditions like stress, trauma, and toxicity. Now, another issue with the nystagmus is that sometimes it's related to inner ear issues, and I've talked about in other video blogs about a condition called Meniere's disease, which is a issue around vertigo and inner ear issues. I do find that there's a correlation between vestibular problems and the possibility of nystagmus. So the key in nystagmus, from a more holistic perspective, is to teach the person self-regulation so that they're able to, at some level, maybe reduce some of the oscillation. Because when you do get nystagmus, to me it's a barometer of stress and trauma, and the more accelerated or the more intense the nystagmus is, again, there's very little regulation, self-regulation in our nervous system and our fluid body, our cranial rhythm, and even our visual system. So the physical eye therapy exercises, craniosacral therapy, and a third thing called continuum movement. These are 3 techniques that I will start employing to teach people how to self-regulate when they get an episode where the nystagmus is really profound. And even with that, it does become a weak point. So anytime the trauma, the toxicity, or the stress really takes off, the person is going to definitely experience more of the nystagmus. Now, with this oscillation, what people experience is more blurred vision, but it does affect things like peripheral vision, depth perception, focus, and even some of the cognitive processing. I can tell you that from craniosacral therapy to continuum movement, these are 2 things that really, when a person starts practicing on a daily basis how to regulate their eyes when they get this kind of movement, they can really reduce the effects of nystagmus on their system. I had a guy about a year ago who had very severe nystagmus, and he was very nearsighted. His was an acquired case, and no real reason why, although he felt that he was under a great deal of stress. And so I began working with him in vision therapy, and we reduced his myopia by about 30%. I put him in some soft contact lenses, which seemed to help. And we did a lot of cranial work. I showed him different dive sequences in continuum movement where he combined sound with breath and slow movements. And I also helped him kind of hook up his vestibular system with his visual system so he had better orientation, better balance. So he was a motorcycle guy. And one day he came to the office. This is after we had been working for a few months. And he said, "Dr. Byrne, I was driving my motorcycle on Bishop's Lodge Road, which is a very beautiful two-lane road where there are a lot of old growth deciduous trees. So it isn't like some other places in New Mexico where there's a lot of desert. There's a creek that runs through there, and the trees are just gorgeous." He said, as I was riding my motorcycle for the first time, I was actually able to see 3D. I was actually able to see the depth, and I felt like my nystagmus actually really slowed down. I said, "That's amazing." I've heard that before from other patients who I've helped with nystagmus. So it is a condition that you can improve upon, even though the allopathic people say you can't. I've had a number of success stories. So it's one of those conditions that can be very troubling, but again, if you use my approach, it can work quite well. So I want to thank you so much for the question. Let's go on to our last question. So this is a question that talks about, let's see if I can read it here. Dr. Byrne, what can I do to heal my surgery after I have my cataracts taken out? I've done your program. The cataracts have reduced, but I've decided to do the surgery. How do I prepare for it, and what can I do afterwards? Well, this is a great question because, my approach does not work for everybody. And I'm talking about reversing cataracts, especially if you have moderate to advanced cataracts. It's a tough go. So what I would say is, number one, you want to make sure you're really boosting your eye antioxidants. A lot of plant-based foods, rainbow diet, anti-inflammatory, that would be number one. Number two, I would probably use the MSM drops. This is great for moisturizing the eyes, improving the lymph system in the eye. You're preparing the eye for the surgery, so any way that you can boost the eye health, you're doing yourself a service. Number three, I would do the eye exercises. I think that if you can reduce your eye stress, again, as you go into the surgery, I think that the less stress you have, the more resilient your system will be from the surgery. And last but not least, I would consider, getting some things like cranial work, acupuncture. Do whatever you can to boost your immune system. Make sure you're getting enough probiotics, fats and oils. It's all the things that we talk about. And talk to your surgeon that you only want the prescription to match the other eye. So the eye that you're having the cataract surgery, you want to have the non-cataract surgery match it for distance. You don't want to do monovision. You don't want to do these complicated situations, astigmatism lenses and monovision and bifocal contacts. I don't recommend those. Now, after the surgery, probably for the first 24 to 48 hours, you're probably just going to be resting. That's really important. So no screen time, rest, relaxation, I think is in order. Make sure you're hydrating enough. And once you get the approval from your surgeon that you're out of any any issue, any infection or inflammation, you can start using the MSM drops. You can use the iBright compressed tea. You can use the castor oil as a massage on the eyelids, and then just boost those antioxidants. Do your eye exercises. Again, I would continue with the cataract approach, the cataract EyeClarity program. And last but not least, remember, when you've had cataract surgery, you don't have the blue blocker in those plastic lenses. So make sure you protect yourself from digital time by using a blue blocking filter. And if you do all of those things and you prepare properly, you're going to sail right through the surgery. So, ladies and gentlemen, I want to thank you so much for your support, tuning in. I really appreciate it. I hope you enjoyed the tour of Santa Fe Rail Yard. And I'll see you back next week for Podcast 101. Until then, take care.